Hola a todos, gracias por conectarse.
Good morning, everybody. Thanks for being connected. We will give you 1 or 2 minutes while you come into the room, and then we will be starting this press briefing. Thank you.
Ahora sí, entonces, hola a todos y muy buenos días desde
Good
Washington.
morning, everybody from Washington, D.C. Thank you for being connected to this press briefing by the Pan American Health Organization about COVID-19 in the region of the Americas. I am Sebastián Noriel from the Communications Department of PAHO. And this session will last from 45 minutes to 1 hour. We will have a few questions. We have received several questions by email. Also, we will answer questions live and through chat, through Q&A. Please include your complete name and ways of communications. When you send your questions, you can ask questions in English and Spanish. Dr. Carissa Etienne, PAHO Director, will inform you about the present epidemiological situation in the Americas, and she will share an update of the preparedness of the region for the rollout of the COVID-19 vaccines. Dr. Etienne is accompanied by Dr. Jarbas Barbosa, Assistant Director of the Pan American Health Organization, Dr. Marcos Espinal, who is the Chief of Department of Communications, and Dr. Silvana Lighieri, Deputy Director, also an incident manager. Now, with you, I will give the floor to Dr. Etienne.
And thank you for joining today's press briefing. Since the start of the pandemic, the region of the Americas has seen over 28.5 million cases and some 753,000 deaths due to COVID-19. And while we've been living with this virus for months, over the past few weeks, our region has been experiencing the highest levels of new COVID-19 cases since the start of the pandemic. In North America, Canada and the United States are reporting jumps in weekly case counts. In Canada, infections continue to climb, and record deaths have been reported in some provinces. Meanwhile, in the United States of America, daily case counts are reaching 200,000 and more than 100,000 people are currently hospitalized due to COVID illness. Mexico is also experiencing a resurgence in cases in the state of Baja California near the US border. North America's continued rise in infections is particularly worrisome as winter approaches in the Northern Hemisphere. Seeking refuge from the cold, People may be tempted to gather indoors in poorly ventilated areas, really the perfect conditions for the virus to spread. In Central America, Panama continues to report a high incidence of COVID-19 cases, and Honduras and Guatemala are experiencing a particular increase in cases in the areas that were most affected by hurricanes Iota and Eta. Approximately 7 million people live in the impacted areas. Many countries in the Caribbean are also witnessing slight but steady increases in cases, such as in Dutch territories of Curaçao, Aruba, and Sint Maarten, and the British territories of Bermuda, the Cayman Islands, and the Turks and Caicos. While the region continues to see a mosaic of different patterns, the situation in some countries of South America is also concerning. Brazil is currently reporting its highest incidence of new cases in South America, with cases and deaths mounting. Brazil's health system is under strain, and hospitals are at capacity in some areas. We're also seeing rises in cases and deaths in areas of Colombia bordering Venezuela and Ecuador. Further south, Paraguay is experiencing a surge in infections, and health authorities are monitoring the situation closely to ensure enough bed capacity to manage critical patients. These figures and trends make it clear that our region must redouble preventive measures, especially in preparation for the year-end holidays. Now is not the time to relax. So it's important for health authorities in our region to act by issuing clear guidance and helping communities protect themselves and their loved ones. We are once again in need of coordinated efforts to boost hospital capacity in the most affected areas. Because when hospitals can't accommodate everyone who's sick, many will die while waiting for care. We are hopeful that the COVID-19 vaccines, which will soon come to market, will help contain the pandemic. But this will take time and advanced planning. So we'd like to share an update on our region's preparations for a successful vaccine rollout. Let me start by saying that while a number of vaccine candidates are under consideration, no vaccine has been approved for distribution across our region yet. This week, PAHO is convening member states in an extraordinary session of our Directing Council where we'll meet with the ministers of health of our region to discuss the preparation for vaccine rollout and the purchasing and distribution of COVID-19 vaccines in the region through our revolving fund and through the COVAX facility. Despite the financial hardships that our region has incurred during the pandemic, countries in the Americas have done their part in securing more than $1 billion in down payments and financial guarantees to engage with COVAX. PAHO has helped several countries in our region navigate and meet the requirements of the COVAX facility, and we're focused on making sure that every country's investment counts. The Americas represent a fifth of all COVAX participating countries, and an estimated one-third of all vaccines that will be procured for self-financing countries via COVAX. But funding is just one area in which we are supporting our member states. We're also working hard to ensure that once vaccines are approved and available, countries are prepared to roll them out. The World Health Organization has developed a readiness assessment tool that PAHO has adapted for our region. to ensure that our member states have the guidance that they need on everything from engaging the staff, from regulatory aspects, communication, resources, and the trainings needed to prepare the health systems for vaccination campaigns, to ensuring their logistics systems, cold chains, and supply chains, and to ensure that all of those can respond quickly. At first, we will not have enough doses to protect everyone. So the objective is to save lives using the first deployment to reach those most vulnerable to develop severe forms of COVID-19. And that's why PAHO has also been supporting member states in developing their national immunization plans. Each country must identify priority groups and adapt the communications campaigns and materials to meet their needs, including by working alongside community leaders to empower communities to seek vaccination. Healthcare workers will likely be among the first to benefit from a vaccine and will also play a key role in raising awareness about the importance of immunizations. To help us keep track of and accountable to progress across all of these areas, PAHO has developed a dashboard, which is live and available for anyone to view. It shows the number of countries that have completed, are working on, or have not yet started preparations. This week we will observe Universal Health Coverage Day. And the impetus behind our work on vaccine access and the motivation behind the COVAX facility is to ensure equal access to safe and effective COVID-19 vaccines. The principles of solidarity, equity, and leaving no one behind have guided PAHO's response to this pandemic from the very beginning. And that's why PAHO has sent more than 20 million COVID 19 PCR tests to give countries better visibility into how the virus is spreading and to help identify those who are infected so they can receive the care that they need. Many donors have supported us in this effort, and we want to thank them. That's why PAHO has also donated nearly 36 million masks, 3 million gloves, and more than 1.5 million gowns to protect health workers across our region. And that's why we have led over 200 virtual and in-person trainings to ensure that ministries of health and practitioners alike understand the latest science and have the skills that they need to combat this virus. The principles of timely access, affordability, and regional solidarity are grounding not just our COVID-19 response or the planning for equitable access to our vaccine, they're guiding our work for over 120 years. And they are enshrined in our region's commitment to health for all. This Saturday marks the observance of Universal Health Coverage Day, an annual event that takes renewed importance during this year of the pandemic. This day serves as a reminder that universal health is not just about ensuring that everyone is covered, but that everyone has access to care when they need it, wherever they are. Health is multidimensional. So fulfilling this vision will require an all of society effort to combat factors that prevent our people from getting the care they need, such as poverty, social injustice, and educational gaps. But as we've seen so clearly with COVID-19, ensuring that people are safe and healthy is foundational to the health of our economies and the health of our nations. Thank you.
Muchas gracias, doctora Etienne. Ahora
Thank
vamos a
you
pasar
so much, Dr. Etienne. Now we will go to the questions and answers. When you write through Q&A, please write down your name and your means of communications. We have received several questions. One of the questions that we have is as follows.
the region for the coming month. What are the collateral impacts that are you most worried about, Dr. Etienne?
So thank you for this question. You've heard me say, and Paajo has said on many occasions, that COVID-19 has ushered what we refer to as a triple crisis that affects our health, our economies, and our societies. And this pandemic has proven that health is foundational to the fabric of our societies and the state of our economies. Food and nutrition is vital to good health. And for me, that's why I'm concerned about the level of food insecurity that this pandemic has brought upon our region. So, even before the first case of COVID was reported in the Americas, 1 in 3 people in our region did not have enough food and they lacked access to nutritious food. But today, hundreds of millions of people across Latin America and the Caribbean, they don't know when their next meal will come. And what is more important, children are especially at risk. UNICEF has estimated that over 141 million children and teens are out of school in our region. And for many of these kids, missing school means missing meals. We know that without the proper food and nutrition, children can suffer irreversible damage to their physical and to their cognitive development. And this we know can lead to poor school performance and can hinder their ability to develop to their full potential later in life. So I believe that the impact on children and on their ability to flourish should be prioritized. And so that's why PAHO has been working with the Organization of American States to ensure that schools in our region can help kids to meet their full potential. This is also why we are in discussion with UNICEF and soon with UNESCO, so we can begin to work together on some solid guidelines for the reopening of schools and maintaining health and safety within our region. So for me, this is a priority now. And once the pandemic is over, we will need to ensure that this continues to be a priority.
Gracias, doctora Etienne. La siguiente pregunta es
Thank you
de
so much, Dr. Etienne. Anthony Waddle is asking this from Brasilia.
Rolled out for the population of Latin America. The African Union said last week it would take 2 to 3 years to get 60% of the African population vaccinated. What is your forecast for how many years it will take to vaccinate 60% of Latin Americans? And is 60% enough to attain herd immunity? Y otra pregunta de Anthony es, are some Latin American countries in better shape in lining up the supply and distribution of vaccines than others? Dr. Barbosa?
Thank you. Thank you for these questions, Anthony. Let me tell you, our focus now is to guarantee that the first phase for 2021, and the first phase is to have a vaccine that will be enough vaccines to protect the most vulnerable population and to save lives. So with these vaccines that correspond to around 20% of the population of each country, we will be able to protect health workers social workers that are in the front line, people with 65 years and more, and other adults with underlying condition, because these people can develop a severe form of COVID-19. So this is the first objective that we have. We don't know how many doses will be produced in 2021 or 2022 yet. Probably we will have this information in the following weeks or even months. So this is our first objective. About the 60%, we don't really know yet what is what is the coverage that we need to interrupt the transmission. Based on other diseases and other vaccines, WHO has an estimation that we will need to reach at least 70% of the population being protected in order to interrupt the transmission. But this is still a hypothesis. We will need to have more research and more information to confirm this. So to reach this level, or to think about not only to save lives, but also to eliminate the transmission of COVID-19, we will need to know, first, what is the availability of vaccines that we will have. Secondly, what is the real level of coverage that you need to reach. But again, let's take it step by step. The first step, and it's a huge step, is to vaccinate this 20% of each population to protect the most vulnerable groups and to save lives. And this is a very important challenge to every country worldwide. And for this reason, we are supporting these countries in Latin America, the Caribbean region, to have their national immunization plans to be ready for vaccine rollout. Thank you.
Gracias, doctor Barbosa. La siguiente pregunta es de Valeria Heredia, del diario El Comercio.
María Heredia, from El Comercio newspaper, Ecuador. She is wondering if you already have received the antigen tests that were mentioned by Dr. Alighieri. Dr. Alighieri, could you please advise us? Thank you so much for your follow-up question from Ecuador. Yes, I will talk about several aspects about our regional policy for access to new diagnosis. Yes, the antigen detection tests from PAHO have reached Ecuador 2 weeks ago. But also I'd like to report that we have mobilized a group of experts last week, and they have been working with the Ministry of Public Health to train the authorities and the operators for the use of these rapid antigen detection tests. These tests ensure the expansion of the detection work of the labs in remote areas with difficult access, especially around the coast of Ecuador, and will be complemented by the INSPI institutes and other agencies, Ecuadorian agencies, to implement the PCR technique. And we hope to learn many lessons in Ecuador on the use of these tests, antigen tests, in the primary healthcare level. PAHO is also working globally through the accelerator initiative so that the countries of the Americas can have access to new diagnostic tests that are efficient and cost-efficient for use at the primary healthcare level. Thank you so much. Thank you, Dr. Alighieri. Adolfo Cuicas, journalist from La República newspaper from Peru. The Ministry of Health of Peru, Pilar Macetti, ensured that there is a real threat of a second wave of COVID-19 in the country. What are the expectations of PAHO regarding this second wave and the Latin American level? I would like to know if there are some countries that have a second wave, just like they have in Europe. Dr. Espinal. Thank you so much, Adolfo. It's an important question. I think, Madam Minister, you are absolutely right. Minister Massetti has alerted the population because, as we have seen in Europe, which is going through a second wave, we are seeing countries of Latin America that have seen the signs of a second wave. In Brazil is reporting more than 50,000 cases. A month ago, it was reporting 20,000. And there's also Uruguay. The curve was flattening, but now we see increases. So we believe that Minister Massetti is right. And what she wants to say is that you should not let your guard down. You should continue with your mitigation measures, continue with informing the population and asking the population to do their part, because you have the jungle, you have the the coastal areas, the Amazon areas, and then you have groups of the population that are extremely vulnerable. So you cannot leave your guard, let your guard down. Yes, Peru is at risk of a second wave. So we have to control the possibility of having the second wave by maintaining all kinds of measures. And as the director said in former interventions, this is not only a public health problem, but it's also an economic and social problem. Thank you so much. Thank you, Dr. Espinel.
Jacqueline Charles from the Miami Herald to make her question. Jacqueline, if you're listening, Jacqueline Charles, si nos estás escuchando.
Yes. Hi, can you hear me?
Yes, go ahead. Thank you.
Okay, great. Thank you. I have two questions. The first one has to do with Haiti. Earlier this year, PAHO sounded the alarm on expected deaths from COVID-19. Even with its limited testing, anecdotal reports show that the country has not been hit as severely as expected. And even when people have gotten coronavirus, they haven't died in the large numbers that we thought they would. In fact, a few months ago, Doctors Without Borders shut down their COVID hospital. The experience of Haiti, of course, is viewed similar to some African nations. Do we know why the virus has not hit as hard in Haiti as elsewhere in the region, including like the Dominican Republic? Is there a different strain of the virus? And then the next question speaks to what Dr. Etienne talked about in her opening in terms of the Caribbean. With the holidays approaching and COVID-19 continuing to spike in the Caribbean, what advice is PAHO offering to these countries? We're seeing various response from Jamaica saying don't come, to Haiti and the Bahamas telling people to come, even though they are among 18 countries the CDC recently issued a level 4 travel warning for.
Gracias, Jacqueline. Quizás podemos empezar.
Thank you so much, Jacqueline. Dr. Alighieri for the Haiti question, and then with Dr. Espinal about travel. Dr. Alighieri.
I'm going to cover the first question regarding specifically Haiti. There is no different strain in Haiti. We have a regional network for monitoring the genomic, the genetic aspects of the strains that are circulating, and no difference regarding virulence has been detected today. And also, it's an aspect that Dr. Etienne and other colleagues have already many times highlighted, is that we have really a mosaic of transmission between countries and sometimes within the same country. So today, Haiti has been mildly affected compared to other countries in the region, but the collateral effects the socioeconomic, health and nutrition are considerable. A recent study, we have some evidence through studies at this moment. The number of cases accumulated as of last week, it's a little bit more than 9,300 cases confirmed by laboratory. The reason for the lower incidence of detected COVID is not completely clear. We have a mosaic in the region. There is a very important serosurvey underway to understand better with partners in Haiti and reference laboratories in Haiti. Nevertheless, it's important to point out that the virus continues to circulate in the country. It means that the risk is there. There are cases every day confirmed by laboratory in Haiti. And the country also is entering a period of risk. There will be a movement of people during the holiday season, visitors, diaspora traveling back to Haiti and coming from countries or regions with a high rate of transmission at this moment. So PAHO is really recommending at this moment to strengthen the surveillance and contact tracing, and especially in some areas and for doing this, Haiti relies on a very strong laboratory network. The 10 departments of Haiti are covered by laboratory network at this moment, and with some initiatives like the Labo-Moto initiative, which allows the nurses to go to remote area, to remote commune, take sample and travel the same day with the sample to a laboratory. And the network of laboratory will be expanded is in process to be expanded during this period. We anticipate 40 more testing sites to be implemented in the coming days and weeks, and including with the use of the antigen detection rapid test that I have commented previously also for Ecuador. So I hope I have answered your concerns regarding Haiti. Over to you.
Gracias, doctor. Para la segunda pregunta.
Thank you very much, doctor. Now we move on for the second question to Dr. Espinal, the question connected to the holiday season and travel. Dr. Espinal.
Question. I think the advice is, if we can avoid traveling and only to undertake essential traveling, we should avoid it. Because it's much better to spend many years doing holidays than to have one that could be very negative for us. So if we can, spare this one and maybe do a holiday season, Christmas Day, New Year's Eve on Zoom or on Teams or Skype or any other virtual meetings, I think that's important. Traveling is risky. We have seen that. There's so many calls in the United States about Thanksgiving, and we can expect a larger upsurge at the Christmas holidays. So while we understand the need for to see loved ones and spend some time, it is important to think also about our own health. Many countries in the Caribbean has kept the virus at bay with excellent mitigation actions and prevention actions recommended by PAHO and WHO. So but the risk is not yet gone. The vaccine, as our previous speakers were saying, is not going to come tomorrow. And you heard that it's going to take probably more than a year to vaccinate the entire world. So we're not going to go back to the normality immediately, and there is an increased risk. So the advice is not to relax the measures, to continue protecting ourselves, to continue avoiding risky situations, because this virus can kill.
it also can be mild and moderate, but also can kill, and we have seen so many deaths. So let's think before undertaking traveling that is not essential. Thank you.
Gracias, doctor
Thank you
Espinal.
very much, Dr. Espinal. Now I would like to give the floor to Melina Ochoa, who is a journalist with TV in Mexico, for her to ask her question. Melina, you have the floor. Melina Ochoa from TV.
Hola, buenos días. ¿Me escuchan?
Good morning. Can you hear me? Yes, please go
Perfecto,
ahead.
muy buenos
Very
días,
well.
Melina
Good
Ochoa,
morning.
reportera
This
de
is
UNO TV en la
Melina
Ciudad de
Ochoa
México.
with
La pregunta
TV
es, pues el día
in
de ayer
Mexico. My
se
question is the
anunció un
following.
plan de
Yesterday,
vacunación contra
an announcement was
coronavirus
made
aquí en el
for
país, el
vaccination
cual arranca para
against
finales de
coronavirus
diciembre
in
y
our
está
country
proyectado
that
en
shall be
5
starting in
etapas.
late December through
Este plan inicia con la
8
llegada
stages,
de la
and we're going
vacuna de
to
Pfizer.
begin
¿Esto
with the
es
arrival of the
suficiente para
Pfizer
mitigar la
vaccine.
pandemia
Is
en
this
el
enough
país?
to
¿Qué
mitigate
opinión le
the
merece a la
pandemic in
OPS,
the
además
country?
que
What
hoy pues
is
hay una
the opinion
información en
PAHO
Reino Unido
has,
respecto a
also
algunas
taking
reacciones
into account
alérgicas
that we
con
heard
esta
about
vacuna?
some allergic
Muchas gracias.
reactions in the United Kingdom because of the administration of this vaccine? Thank you very much, Melina. Dr. Barbosa, can you answer? Thank you, Melina. Now, first of all, in connection with these reactions, they have to do with allergies. It may happen with any vaccine or medicine, so there is already a warning for individuals who already had serious allergic reactions. They should not be vaccinated with the Pfizer vaccine. This is not something that is going to have an impact on many more people being vaccinated, but Mexico will need to complete their universal vaccination campaigns with other. It won't be possible to complete those universal vaccination campaigns. You need syringes, you need needles, you need training, you need professionals, you need communication for the individuals, and also the definition of the risk groups to be vaccinated first. So that is very important. Mexico is already working on this. Our office in Mexico is working in support of the Health Secretariat. As to the vaccine, from the very beginning, we have been working with COVAX and the COVAX facility with a view to having the vaccines available in March, April 2021. It could be possible that we have an early batch available, but that is the date that we keep in mind. That is the date that we think is the most feasible. There are some countries, such as Mexico and many others, that have bilateral agreements with some producers and who will be receiving a fixed lot, a small lot, in late November, early December. We do not have all of the information, but I am sure that if there is a vaccination plan that is important, any vaccine that makes it to the market will be a vaccine to protect the most vulnerable, that is to say, the elderly, health workers, and other social workers in the front lines, and also adults who may have other conditions such as cancer, diabetes, hypertension that could be at risk of developing a severe form of COVID-19. The first arrival of the vaccine will not be a vaccine to interrupt transmission. This is going to take months, and during those months, Melinda, we do believe that we know what it is necessary to diminish transmission. The examples come from various countries in Latin America, North America, Europe. We need to maintain all of the individual and collective measures, such as the use of face masks, also to maintain social distancing, not to participate in gatherings in enclosed spaces, not to leave the home unless for essential activities. Hand washing, those measures are efficient to interrupt transmission because during many months we will still be working to attain interruption of the infection. The vaccine is an excellent piece of news, but it is not magic. It is not something that is going to completely interrupt transmission overnight. We need to maintain the measures, and this is going to be very important for us to have the possibility to address the pandemic. Thank you very much. Thank you. I would like now to give the floor to Blanca Valadez from Millennium in Mexico, who will be asking her question. Blanca, can you hear us? I'll give you the mic. Can you hear me? Yes, please go ahead. Good morning to all of you. I apologize because of the street noise, but when do you think, you already said that this is a plan that is being analyzed, but when can we consider, or when can people go back to hugging, going back to the streets, kissing each other? Is this going to be impossible to predict for the next 2 or 3 years? And also, because of the Pfizer vaccine, we understand that it needs ultra freezing. So what are PAHO and WHO doing so that countries that have fewer resources have the equipment they need, the more sophisticated equipment they need to accept the vaccine? And what do you think of the management of the pandemic in Mexico? Well, thank you, Blanca. We have several questions. We're going to start with Dr. Espinal. Very well. Thank you, Blanca. The question as to face masks and going back to normal activities and hugging each other, I think that Dr. Barbosa before me already referred to that answer. It is not a good idea to forecast the time. It's going to take time. We have talked about 1 year, 2 years. Face masks in Asia have been used for years. So as Dr. Barbosa mentioned, we have a combination of measures. We should not despair that we are going to see the elimination of these measures tomorrow. The next 2 years are going to be critical. As we said before, vaccination is not going to happen overnight. And for us to attain herd immunity, we will need a large section of the population, 70% of the population, 80%, 60% vaccinated, let's say 70% of the population. This is not going to happen overnight, but as Dr. Barbosa has just mentioned, several of the vaccines are being tested. They won't be used tomorrow. So we need to continue with the measures, the face masks, hand washing, avoiding closed spaces, indoor spaces, and also have small gatherings, because this is the only, these are the only measures that will be helping us. This is a lethal virus. We do not have answers to many of the questions. So our populations need to be firm and also listen to the ministries of health, their recommendations, the recommendations by organizations such as PAHO, because they will help us preserve lives. I wouldn't dare set a timeline or give you a number of months. I know that the next 2 years, at least 2021, will be critical, and we will see how this evolves, and we will be able to talk about this again. But in the meantime, we do hope to continue to use face masks and follow the recommendations. We won't be able to attain that herd immunity immediately. Thank you very much. Thank you, doctor. The next question, also linked to what Blanca asked, comes from Tanya Mead-Carwith from Tribune in Bahamas. She says,
drug, which can only be stored at minus 95 degrees Fahrenheit, will PAHO be assisting countries with means of storing this drug when it's made available, as most countries in the region does not have the means to store it? Dr. Barbosa?
Thank you for this question. You see, COVAX facility, and I think that the very important thing about COVAX facility, besides to be a mechanism that for the first time are trying to get equitable access to a vaccine that will be very important to save lives first, and after that to control the transmission, is that in COVAX facilities we are getting a basket of producers. We are not relying in only one producer. When a country makes a bilateral agreement, he is relying only in that specific producer. In COVAX facility, we are in the process, in the bidding process, with the UNICEF, our revolving fund of PAHO, and we are getting proposals from many different producers. We have one producer that is Pfizer, that its vaccine is requiring this very, very low temperature to be stored, around 100, minus 100 Fahrenheit. But the other producers they have products, they have vaccines that can be stored and can be transported using the current cold chain that the countries have already in their national immunization programs. So this is the kind of information that each country needs to have in order to make the best decisions about what are the vaccines that they want to use. PAHO, through our strategic fund, we are also in contact with the producers of these freezers. They are very specific products. In many countries, they have these freezers being used in hospitals, in some research laboratories and other facilities. But we are trying to get also new producers that some countries that will use the Pfizer vaccine can purchase this kind of freezer. So I think that this is important to have all this information when a country makes a decision that I will make a bilateral agreement with producer A, B, or C. It's important to have this kind of assessment to make a decision based on the facts, based about the best option for each one. And for COVAX, again, we hope by February 4, 5 or more producers, and the countries can choose the best products that have the better combination about affordability, about the cold chain that they have already implemented. So this will be, I think, that the best option for each country.
Gracias, doctor. Tenemos varias preguntas vinculadas.
Thank you, doctor. We have several questions related to vaccination. Another question that we just received
Financiero de Chile.
From the Financial Journal in Chile, she's saying that in several countries the vaccine will not be mandatory, and she's asking whether PAHO and WHO will work with the countries in campaigns for the acceptance of the vaccine, and she's also asking whether we could eventually face a situation in which we have mandatory vaccination in the region. Dr. Barbosa. Thank you for the question. The decision to have mandatory vaccination is a decision to be made by each country based on their vaccination rules and laws. In many of our countries, we have mandatory vaccination for children, but today we should not be talking about the mandatory nature of the vaccine, but we need to talk about the availability of the vaccine, the vaccination plans, the strengthening of COVAX and all of the facilities. COVAX does not have all of the funds that are needed at this point in time to support the poorest countries in the world. So it is very important to call donors, rich countries that could participate in this equitable mechanism. I think that in each country, it is very important to properly inform the population, also to show the population that the COVID-19 vaccine, the vaccines against COVID-19 are the result of a tremendous effort that tens of thousands of research centers, biotechnology centers, vaccine producers are carrying out. And those vaccines are complying with all of the requirements to make certain, to make sure that they are quality and effective vaccines. So that's the reason why it is important for all of the governments, as part of their national plans for vaccination, do have transparent communication, direct communication with all of the parties, for health professionals, for families and individuals, so that everyone can make a decision to have access to the vaccine as soon as it is available. I think that this is the most important element at this point in time, and PAHO is supporting the countries in the region for the development of the plan, and also providing information for the social media, the journalists, and also health professionals on the vaccine. I think that this is the way we are going to allow us to have a high level of vaccination for the population, first to save lives and second to control transmission. Thank you. Thank you, doctor. In the chat, Nicolas Luco from El Mercurio, Chile, is asking whether the cemeteries and funeral services are also important pockets of contagion, pockets of transmission in the countries. Is there any information about this, Dr. Aldiguieri? Thank you. This is Dr. Aldiguieri for that question by El Mercurio. We have two separate aspects. The first one has to do with infection control, that is to say, during the management of the body of the person of the deceased person due to COVID-19, transportation and burial. And there is an aspect that has to do with public health measures and also the ceremonies, that is to say, the mass gatherings in religious facilities and also at the cemetery for infection control. And also this includes health staff and also the workers of companies that provide funeral services. We have guidelines for managing the corpse and also EPP and also PPE and also the various measures and guidelines to be followed. As to health measures, all of the countries in the region have defined, based on their pandemic response phase, what public health measure in terms of individuals need to be followed strictly. And the rules determined by the health authority or the public authority need to be followed at the level of the municipality or at the local level. When those two groups of measures come together, the risk of infection from the body of deceased individuals due to COVID-19 is inexistent. So once again, I would like to highlight that the set of measures, the two measures of infection, that we need to implement infection control and also public health measures. We are reaching the end of the session today. We have several questions related to vaccines. And to put some of these questions together, it says,
especially for low and middle income countries. How confident is PAHO that the rollout of a vaccine will be fair and equitable in Latin America and the Caribbean? Dr. Etienne?
So thank you for that important question. And I can see there's a lot of interest around vaccines and the access to a COVID-19 vaccine. So our work in PAHO is based, as I've said before, on the principles of solidarity and equity, and from the beginning of PAHO. And the COVAX facility is based on these principles. And so that's why one of the really very important reasons why we are working hard in the COVAX facility to represent our member states. This really, as Dr. Barbosa has just said, is an unprecedented partnership that is working to achieve something that has proved very difficult in previous outbreaks. And that is ensuring that every country, irrespective of their income level, would have equal access to safe and effective vaccines without too much delay. So this really is the first time that we have a mechanism in place before a vaccine is registered. And we believe that it will make a huge difference. But I want to reiterate something that was said before. Really, let us be clear that initially the supply will be limited everywhere, regardless of whether the countries are participating in the COVAX facility or those who have had direct bilateral negotiations with pharmaceutical companies. So we know that there will not be enough vaccines for all at first. And so the goal will be to prevent severe illness and deaths. And both Dr. Barbosa and Dr. Espinal have mentioned this. And so that's why in PAHO, we have been advising countries that the first doses should go to those at the highest risk of infection. For instance, our healthcare workers and the elderly. And after this first priority, groups, we expect to see a gradual rollout of doses that would allow countries to offer the vaccine to other priority groups, like persons with underlying conditions, and to eventually reach others who may not be as vulnerable to severe COVID-19 symptoms. So as you heard, it's going to take some time. It's going to take beyond 2021 to arrive at the goals that we set ourselves that will control transmission. But really, we are eager to see COVID-19 vaccines broadly available, but it is important to understand that it will take time and that coordination across countries will be essential. We are counting on our member states to share resources, to work closely with PAHO and the COVAX facility to ensure equitable access to the vaccine. The majority of us must all be protected so we can end the pandemic, control transmission. And as has been said before, until then, we will need to rely on what we know works well. Social distancing, the wearing of masks, and the avoiding of crowded indoor spaces. Remember that a vaccine is only one of the tools that we will need to control COVID-19. And a vaccine will work better in combination with other measures. So we are looking at a total and holistic approach to the reduction of transmission as we move forward to ending the pandemic. Thank you very much for being with us.
Muchas gracias, doctora Etienne, y muchas gracias.
Thank you very much, Dr. Etienne. Thank you all for being with us today. We have reached the end of our session of our press briefing, and you will see on our website information on the COVID-19 situation. As the director mentioned in her speech today, you can see www.paho.org/coronavirus. You will be able to find that information there. And briefly, we will be sending you the opening remarks by Dr. Etienne, as well as the recording of the session, and you can continue to contact us via email, and we will be answering as soon as possible. So thank you all for being with us today, and we will see you next week. Greetings.